My name is Henry Ramirez. I'm a board-certified OBGYN. Prior to going to medical school, I was an occupational therapist. I had a master's in occupational therapy, so I did do a lot of pelvic floor rehab and understand the muscular system as well as the patients in whole from way before my medical school. I also was a proctor in robotic surgery for many years, integrative medicine fellow as well, and I was the one who developed the femtite that we'll talk about today. So I took a clinic that was 100% managed care, all bread and butter OB, delivering babies, doing surgeries, and I converted it to a cosmetic gynecology clinic. So I went from 100% insurance, which we all know no one really likes that, to now I have an 80% cash, 20% clinic, and then I have 2 other clinics at 100% cash. So let's talk a little bit about the standard of care for the female pelvic floor. I still remember when I was that young little student seeing my first vaginal delivery. How many of you guys seen a vaginal delivery in this room? Most of us have. Most of us have. So I still remember being behind my attending and watching this baby's little head starting to crown and me thinking to myself, no way. There's no way. No way that's going to fit through there. And the attending, of course, they get great kicks out of young students like me because they know what's going to happen and they know that I don't believe it. So they're like, what do you think? Should we get back and do a C-section? I'm like, of course. That's not going to work out so well. So a few minutes later, the miracle of life happens, right? And I'm back there. My heart's pumping and I'm thinking, oh my God. But the vagina is, it's got lacerations everywhere. You got this wet baby, and I'm thinking and I have my occupational therapy hat, or my therapist hat, thinking, oh, that's gonna need all kinds of rehab. There's no way that returns to normal.